This is a recording for the Occupational English Test, and the test is held at the JG International School, Ahmedabad on 17th of December. The candidate name is Twinkle George. The candidate number is 2754. The interlocutor name is James Alexander and the interlocutor number is 5633. This is role play number 1 for the profession of nursing. Twinkle, this is a test of your English language, not an assessment of your professional knowledge. Keeping that in mind, speak as you would naturally. In the role play I will be taking the part of the patient and you will take the professional role. The role play will last for 5 minutes. You will have 3 minutes to prepare for the same.
Good morning. My name is Twinkle. I am one of the registered nurses in this clinic.
Good morning, nurse.
Could you please tell me your name and age for the documentation purpose?
Of course, nurse. My name is Alex. Age 25.
Well, Mr. Alex, if I am not wrong, right now you are on carbamazepine medication. Am I right?
Yes, you are right, nurse.
How have you been coping to this medication since you started?
Generally, I am feeling okay. I think my medication is helping with the seizures.
Oh, I am happy to hear that. Well, Mr. Alex, I would like to ask some queries regarding the seizure you had. Is that okay for you?
Yes, sister. You may ask.
Could you please explain the difference you had felt after taking the medication?
Before medication, I had 1 or 2 seizures in a week. However, since my medication was started, I only had 2 seizures in the last month, and they didn't seem to be as bad as before.
Thank you for providing this relevant information. I just want to confirm, is the medication is more effective?
I am happy that the medication helped to reduce the number of seizures.
Do you have any concern?
Yes, sister. I am worried because I am experiencing some side effects.
I appreciate your concern. Have you experiencing side effects like dry mouth, dizziness, headache, and blurred vision?
Yes, I often have dry mouth and sometimes headache. But no blurred vision or anything else. But I am worried whether these side effects may continue.
A reasonable query from your side. See, Mr. Alex, these symptoms are not a unique issue. It is ubiquitous for who all are taking this medication. Try not to be worried. It will disappear after 2 weeks. Am I clear so far?
Yes, sister. I would like to know what can be done if the side effects is not disappearing.
All right, Mr. Alex. I can understand your concern. I will suggest some more remedy in order to prevent dry mouth. You can use sugar-free gums and you can hydrate yourself with fluids. Also, I will recommend you some over-the-counter medication if the headache persists, which will help in pain relief. How does that sound?
That sounds good, nurse.
I would like to remind you that if the symptoms are persistent, you can seek medical help. Do you have any further concerns?
No, nurse.
I strongly recommend you to continue this medication until the next review along with this. If there is no any improvement on side effects, you can seek medical attention as soon as possible. And request alternative medication for your condition.
Yes, nurse. I will continue the medication until my next appointment with the doctor.
Moreover, I would like to recommend to make an emergency appointment with the doctor if the symptoms gets worsen, like unsteadiness, poor concentration, or vomiting, etc. Are you getting my points?
Yes, nurse.
Do you have anything else to ask me?
No, nurse. You have cleared all my doubts.
Well, Alex, once again, I reassure you that you will be able to make a complete recovery if you adhere to these instructions.
Okay, nurse.
I hope I have cleared all your concerns. Thank you for listening to me patiently. If you have any further concern after going home, you can call us. We will be available here at any time. I wish you to have a speedy recovery.
Thank you, nurse.